Hi, I'm Dr. Meschino, and I want to talk to you about a new study that was released recently looking at the benefits of supplementation with glucosamine sulfate in patients that have osteoarthritis of the hip and the knee. So in 2010, in the journal called Arthritis Research and Therapy, the study by Norman Ang and fellow researchers showed this. They took 36 patients that had osteoarthritis who were very sedentary, very inactive. These were patients between the ages of 43 and 73 years old. They gave them 1,500 milligrams a day of glucosamine sulfate, which is a standard dosage of glucosamine, and they asked them to take it every day for 6 weeks. And then at the end of the 6 weeks, they said, what we want you to do is keep taking the glucosamine, but start walking about 30 minutes a day, 3 to 5 times a week. Then after those 6 weeks had ended, they said, now we want you to extend your walking program. So you add another 30 minutes to the daily walking. So now they're walking about an hour a day, 3 to 5 times a week, still taking the glucosamine sulfate supplementation. So here's what the results showed. It showed that in the very first 6 weeks of the trial, when the people were only taking glucosamine sulfate, they already started to show a reduction in pain, swelling, stiffness, and they had improved joint function just with the glucosamine supplementation. Then when they added the 30 minutes of walking, they noticed that their symptoms improved further. So people with osteoarthritis of the hip and the knee start to benefit by just gentle to moderate activity, just a walking program that's fairly low impact. Here's the other thing they noticed. When they asked them to start walking an hour a day, they noticed that people didn't have any further improvement than they were getting when they just walked 30 minutes a day. Now they probably burned more calories and became more aerobically fit, so it's great if you want to extend the walking time. But the bottom line is that just 30 minutes of walking 3 to 5 times a week in conjunction with glucosamine sulfate supplementation can dramatically improve the symptoms and the signs and your quality of life as well with respect to osteoarthritis of these weight-bearing joints such as the hip and the knee. So the key point is that glucosamine sulfate is really an advantageous supplement to be taking, and yet many doctors worldwide have not yet recognized the value of glucosamine sulfate, and they sometimes discourage patients from taking different kinds of supplements because they claim they don't work. But glucosamine really does work. And osteoarthritis is the main musculoskeletal disorder that affects almost all of us in our lifetime as we get older. And there are numerous other studies that have shown in the past that glucosamine sulfate, not the other forms of glucosamine, you see glucosamine hydrochloride and acetylglucosamine. I'm talking about glucosamine sulfate, that's the form that you want, has been shown in numerous double-blind studies to improve osteoarthritis symptoms, stop cartilage from breaking down in our joints, reducing joint swelling, and improving joint function. So this study in 2010 just supports the body of evidence that we had prior to this. So how does glucosamine work? Actually, our bodies make glucosamine at optimal amounts for us up to about the age of 40. So people think glucosamine is a supplement, but the truth is that glucosamine is something your body's making throughout your entire life. The problem is as you get older, you stop making optimal amounts. When that happens, glucosamine, which is required to help maintain your joint cartilage, is not there at adequate levels, so the cartilage slowly starts to break down in our joints, and over time that leads to osteoarthritis. It's one of the major contributing factors as we get older that leads to osteoarthritis, an inadequate amount of glucosamine that the joints require. So taking a supplement of glucosamine makes a lot of sense because we've seen that it can compensate for what your body no longer makes for itself. So what I recommend for people is that even if they don't have osteoarthritis, by the age of 40, they should start taking a glucosamine supplement, just low doses, and I'll talk to you about those doses. If you already have osteoarthritis, then you're going to need 1,500 milligrams a day minimum to help on a therapeutic level. I think it's best always to combine glucosamine with some anti-inflammatory herbs that can help to suppress the inflammatory response in our joints that occurs as we get older as well. So I like to combine it with 3 natural anti-inflammatories, MSM, quercetin, and of course bromelain enzymes that come from the stem of the pineapple plant. So that's what I did in the product called the Diva glucosamine joint formula. I put the glucosamine sulfate in there with the MSM and the quercetin and the bromelain enzymes to make it practical to actually absolutely follow through with these recommendations. So if you don't have osteoarthritis and you're over the age of 40, you would take 1 capsule a day, which would give you 500 milligrams of glucosamine and some anti-inflammatory herbs. If you already have osteoarthritis, you'd be taking 3 capsules a day. But if you're way over 200 pounds or you're on a diuretic drug for, say, high blood pressure, you're washing it out faster, you're going to need 4 capsules a day. A lot of companies make the mistake of combining glucosamine with chondroitin sulfate or chondroitin of some kind. And chondroitin just doesn't even get absorbed very well. I mean, only about, somewhere between 0 and 10 or 13% of the chondroitin gets absorbed. And so most of it doesn't. So it's a wasted nutrient to put into a glucosamine supplement. You're far better off with MSM, quercetin, and bromelain. Now, the medical treatment for osteoarthritis is often they give you anti-inflammatory and pain-killing drugs like acetaminophen, Tylenol, or aspirin, Voltaren, indomethacin, ibuprofen, Celebrex. You're familiar with these drugs. And they help to control pain and inflammation very well. The problem is that things like acetaminophen, if you take them often enough, can cause very serious liver and kidney damage. And so can the other anti-inflammatory medications can do the same thing. And also cause bleeding and ulcerations in the intestinal tract that can lead to some internal bleeding problems. So the idea is that over your lifetime, you want to try to minimize your intake of those medications because they can have these side effects. And so the things that can help reduce your reliance on those things are glucosamine and natural anti-inflammatories and a walking program. So my recommendation is that if you have osteoarthritis, to be taking a product that has the glucosamine and anti-inflammatory agents. Do the walking program of 30 minutes at least 3 times a week to get the additional benefit. If you don't have osteoarthritis yet, but you're over the age of 40, I'd still be taking 1 capsule of something like glucosamine joint formula and remaining physically active to keep your joints and your muscles strong. Thank you for watching.